Anterior Cruciate Ligament, ACL repair. Introduction. The knee joint allows the leg to bend up and down as well as side to side. Select true or false. Correct. The knee allows the leg to bend in one plane only, up and down. Ligaments protect the knee from going sideways and getting injured. Most often a person injures their ACL with a direct blow to the knee. Select true or false. Correct. Most often a person injures his or her ACL with a sudden twisting motion. This may happen if you suddenly stop or quickly change direction. The only way to restore stability after an ACL injury is through surgically repairing the ACL. Select true or false. Correct. Physical therapy and rehabilitation may restore stability in the knee without surgery. Surgical solutions are tried when physical therapy and rehabilitation have failed. Are heart attacks and other anesthesia-related complications common during and after an ACL repair operation? Select yes or no. Correct. Anesthesia is very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous. Even though they are unlikely to happen, they can rarely cause death. Symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely a blood clot can cause death without giving any other symptoms. Are infections very common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections may happen. If they happen, they are often treated with antibiotics. It is impossible for the knee to lose full range of motion in this operation. Select true or false. Correct. It is very unlikely but not impossible for the knee to lose full range of motion in this surgery. Although the risks of this surgery are rare, they can still happen. The operation tends to be very successful. Select true or false. Correct. The operation is very successful. However, complications may happen. Thank you for using Explain.